It is Wellness Wednesday, and today we're talking about the importance of spine health. We're joined in studio this morning by Dr. Richard Roberts. He's a spine surgeon at Memorial Healthcare Center for Orthopedics, talking about health issues related to the spine and the overall importance of taking care of your spine. Good morning to you.
Good morning. Thank you for having me. It's great to be here.
Yeah, thank you for being here this morning. You know, first off, you brought a model for us this morning. The spine looks like an intricate thing. Talk about the importance of spine health overall.
Sure. So spine is broken up into the cervical spine or the neck, the thoracic spine or the mid-back, and the lumbar spine, the low back. And in any of those areas you can have conditions. They could be from trauma or degenerative conditions or deformity that cause pain, whether it's in the neck or the low back, or pain that radiates down an arm or a leg.
Well, expand on that a little bit more. You know, what are some of those top issues that you see related to the spine, and, you know, how can they affect someone's quality of life?
Sure. So some of the most common conditions I see for patients who come into my clinic are, for example, in the neck, patients will come in with neck pain, and sometimes that's accompanied by radicular symptoms, which is maybe pain that radiates down an arm, maybe with numbness or tingling in fingers, weakness in an arm. Similar to that in the low back, pain that radiates down their leg, accompanied by chronic low back pain, maybe has numbness or tingling in their toes, some weakness in their legs, as well as symptoms of spinal stenosis. So that's narrowing on a nerve, whether that's the spinal cord in the neck or the thoracic spine, or compression on a nerve root that exits the spine.
Yeah, so a lot of considerations there when it comes to pinpointing, you know, an issue in your spine. So walk me through that process. Someone comes to see you. What are some of those things you do to figure out what's going on?
Sure. So when a patient comes to the clinic, the most important thing is to get a good history and physical. So understanding what are their symptoms, how long have they been there, how does it affect their quality of life? And that's my job as a spine surgeon, to evaluate them, diagnose them, and then typically with an advanced imaging like an MRI or a CT, that allows me to understand what is going on in their spine and what I can address and do about it, whether that's conservative or surgical.
Well, talk about those next steps then. You know, what are some of those treatment options these days on addressing spine health?
Sure. So classically, you know, most spine conditions can be treated conservatively. And by that I mean with physical therapy, medications like anti-inflammatory medications, injections where you can pinpoint a specific nerve that has pain accompanied with it, or those symptoms that I talked about, and you can exhaust the conservative treatment. And then when the conservative treatment options have failed the patient and they're looking for a better quality of life, then we entertain surgery. And each surgery is tailored specifically to the symptoms that the patient has and what they're looking for to improve their quality of life.
But bottom line, there are options to address any pain surrounding your spine, right? And then overall, your ultimate goal is, like you said, just to improve people's quality of life, right?
Correct, yeah. So patients will come in and they'll say, I've had this maybe as a chronic or an acute injury, and what can I do about it? And it's my job to understand what they're looking for based on their age, their injury, and what kind of improvements they're looking for in their life. And as a spine surgeon, I enjoy meeting all new patients, helping them understand what is the cause of their symptoms and what we can do about it.
You'll be in good hands. We appreciate your insight and expertise this morning. Our thanks to Dr. Richard Roberts, again, a spine surgeon at Memorial Healthcare Center for Orthopedics. There's more information on your screen, a number to call, and a website as well. Again, thank you, sir.
Thank you. Thanks for having me.